years ago, when my spouse started his own company, he was self-employed. We continued our health care coverage through COBRA and then CalCOBRA, or California COBRA. COBRA is a program to allow a short-term continuation of health insurance at group rates when an employee leaves employment. An individual pays for the entire premiums. For the last year, our COBRA payments have started eating into our college savings for 2 of our children, as well as other savings due to the weak economic environment. For some reason, CalCOBRA covers only medical, no dental, and no vision. We plan to pay for those expenses out of pocket, but now we have delayed some dental and vision visits. When our CalCOBRA ends next month, we have an option to enroll in a conversion program with even higher premiums and higher deductibles. This entire process, facing skyrocketing healthcare expenses, has left us very stressed and with a feeling of vulnerability.
I share Bev's sense of vulnerability, as well as feelings of anger and fear. I was fortunate enough to retire at 60, but I was unfortunate in that I discovered I was uninsurable because of minor pre-existing conditions. I have high cholesterol, which is controlled by medication, and mild sleep apnea characterized only by loud snoring. Fortunately, I was able to continue my health coverage through COBRA. Unfortunately, this coverage will expire a year before I am eligible for Medicare. I'm scared I will get seriously ill or in an accident during this gap period, and I won't be insured or will be underinsured, and my husband and I will lose everything. I am mad because we did all the right things, worked hard, saved, didn't go into debt, and invested conservatively. We retired early to travel. We're deferring that now. We were supportive of our only child's choice to become an independent filmmaker, knowing that his future was secure because of what we would leave him. However, when he recently needed major dental work, rather than ask us to pay for his root canal and crown since he had no dental insurance, he chose to cash in the bonds that he had received in honor of his bar mitzvah to cover the cost. It is clear now that we didn't really have the control we thought we had over our lives. Tonight is about stories like ours. This crowd gathered here tonight demonstrates how much healthcare reform is needed in our community and our country. Most people recognize that low-income people have limited access to health care, and we must fight for that to change. Tonight, though, we are here to uncover the often hidden but growing and painful problem of how our current system of health care is failing the middle class as well. Many of us have felt ashamed of the health care problems we face and have kept them private. Tonight, we will share our stories, because we understand that we are not alone and that our elected officials and the general public need to be aware of our experiences. The healthcare system is failing not just a certain segment of our community, but the vast majority of our country, and reform is needed for all of us now.